Hi,
Hi, Carmen. How are you?
I'm good, thanks.
Good. So I understand that you wanted to talk about breast cancer screening guidelines today.
Yes, that's right. I'm just curious about when I need to start getting mammograms.
Okay, great. Well, I'm glad you've come to me as all this information can be a little overwhelming. So remind me, how old are you?
I'm 40 years old.
Okay. And it looks like you're overall healthy and don't have any diseases or disorders.
Yes, that's right. I've been healthy my whole life.
Okay, excellent. And no smoking in your history either?
No,
Okay. And then are you sexually active?
yes,
Okay. And you're not pregnant, correct?
definitely not.
Okay, great. So let's start talking about those breast cancer guidelines. What kinds of questions do you have for me?
So, I've heard a lot of information on breast cancer from friends and family regarding getting screened. Some of my friends told me that I need to start getting mammograms now, but others told me that I don't need to yet. Basically, wait until I'm older. I'm just overwhelmed with all this information and just want to find out for sure what I need to do in regards to screening.
Okay. Well, I'm so glad you've come to me to talk about this. I get my recommendations from the USPSTF and from the American Cancer Society. For someone your age, the recommendations, especially from the USPSTF, are not super concrete.
So, what does that mean for me?
So it means that the decision to start screening should be kind of an informed conversation between myself as your provider and you as the patient. Like I said, there's not concrete evidence for screening or not screening at this age for you. And overall, the USPSTF states that for women ages 40 to 49, the net benefit, while it's positive with the every other year screening that they recommend once you get over that age of 49, is small. And on the other hand, the American Cancer Society recommends for a woman of average risk, that is, they define that as a woman with no personal history of breast cancer, a strong family history of breast cancer, or a mutation in the BRCA gene. They have to be aged 40 to 44 as well, though they have the option to start screening every year at that point.
Wow, that's interesting to know. I guess I'm a little confused on what could be so bad with getting screened. It can't hurt, right? And why do different organizations have different recommendations?
Well, Carmen, that's a great point you bring up. So screening can be a great option for some people and not for others. But according to the USPSTF guidelines, you're what's called the C category for screening guidelines. And so these different organizations, they often do their own research to kind of figure out what their own recommendations would be. But they both have come together to say that, having these conversations with your healthcare provider and being aware of the importance of regular screening is very important and beneficial. Doesn't mean that one body is necessarily better than the other. Does that make sense?
That's great to know they have value screening importance. What does a C category mean?
Okay, so it's a good question. So a C recommendation states that the decision to screen is based on if you kind of want it, your values, your needs, and my professional judgment on kind of your clinical picture.
That seems very confusing. How can I make such a decision? What if I make the wrong decision and I miss something?
I completely understand where you're coming from. Breast cancer can be a scary thing, but we'll go through it and we'll figure out what we need to do for you.
Okay, that sounds like a great plan. So, what are the benefits of getting a mammogram for someone like me?
So one of the top benefits to getting screened is finding any suspicious lump or a mass that could lead to a diagnosis of breast cancer.
That's obviously something that I would want to know. Well, now I guess tell me about the negatives. What could be so bad about screening right now?
Okay. Well, like I stated, the net benefit of screening with a mammogram for women ages 40 to 49 is small. This is due to both false positive and false negative results, overdiagnosis, some anxiety along with other psychological responses, pain during the procedures, and also radiation exposure as well.
So, what does overdiagnosis mean?
Good question. So overdiagnosis refers to a woman getting a diagnosis of cancer, specifically breast cancer, if abnormal lesions or masses are found. Now, this may sound scary, but those abnormalities are unlikely to become significant in the absence of screening at this age group for you. These overdiagnosed women, they actually may be harmed by the unnecessary procedures and the treatment as well.
Oh, I didn't even know that I could have lumps and they're not always cancer.
Yeah, that's definitely a common misunderstanding, but I'm glad I can kind of put your mind at ease with that. Also, screening women ages 40 to 49 It may reduce the risk of death from breast cancer, but the number of deaths that are overall prevented is smaller than in older women. So overall, the evidence isn't all that great for women of your age to get screened.
Dying from breast cancer is definitely a scary thought in the back of my head, but it's so reassuring that the risk is much less in my age range. But how did the USPSTF come up with that evidence related to the benefit or no benefit of screening younger women?
Great question. So overall, they found that the net benefit for women ages 40 to 49 for mammogram screening is positive, yet small. Like I stated earlier, the USPSTF calls this grade a screening based on professional judgment and patient values and needs. Their evidence for the screening grade is what they call low, meaning the evidence is more insufficient to assess the health outcomes for this patient.
That makes total sense. Now, with all this in mind, what can I do to help prevent breast cancer? One of my friends was told to start taking a medication. Do I need that as well?
So it's likely that your friend has more risk factors that put her at higher chances for breast cancer. In your case, since you don't really have those risks, the USPSTF does not recommend taking those medications for you personally. And those would be medications like famifaxine, ralifaxine, or aromatase inhibitors, which is probably what your friend might have been taking. What you can do is limit alcohol use, maintain a healthy weight, and be physically active as well.
That's great to know. I definitely will make sure I do those things.
Excellent. Do you have any other questions for me?
No, that was everything. For everything I learned today, I think I'll wait to get screened.
And I think that is a completely reasonable plan for you. If you think of any other questions or concerns, feel free to let me know or shoot me a message.
I will. Thanks again.
All right, Carmen, we'll have a great day.
Thanks.